When I was diagnosed, I was 25, and the first thing they told me is they said you can't have alcohol anymore. And I was used to drinking wine. My mom is French, my dad is Spanish. Wine was part of our culture and our heritage. And they told me you can't have alcohol, you can't drink anymore. And it's not like I want to drink, all the time, but I certainly enjoy a good glass of wine or a good beer. And I was horrified by that. And I thought this can't be. So I started doing some research in the area, looking through the research, and found that alcohol is like anything else. You have to have a couple of rules that change how you do it with diabetes, but it can be folded into the diet. So that was a challenge, I guess, the one challenge I think about, because back in the old days, before we thought through ways to individualize the diet, people were concerned that if you were drinking and you became hypoglycemic, they would think you were intoxicated, and they would end up arresting you and throwing you in jail, and you become severely hypoglycemic and possibly die in jail for the mistaken identity of being, intoxicated. Well, that's really not the case anymore, and we know better than that in the modern era, but that was a concern. So I learned to drink. And to drink responsibly. There's a couple of rules I think you should follow and things you need to be aware of. Clearly, we know that if you drink, it can blunt your liver's ability to release glycogen or store glucose out of your liver in response to hypoglycemia, and thus help you become more hypoglycemic. So you really need to think about eating when you drink. You should have a little bit of food as you consume alcohol and not just sit down and pound alcohol. The other thing that you have to think about is if you're like me and you're taking insulin and you need to be able to sense the onset of hypoglycemia, you don't want to mask your ability to feel your own body very much. So drinking to excess to the point where you're sort of feeling no pain, as we say, while that may be good for some things, it's not so good for diabetes, where you really want to know when you're becoming hypoglycemic and correct it before somebody else has to correct it for you. I think that's a rule. You can incorporate it into your diet, and it's usually treated as a fat and exchanged much as a fat would be. But you also need to be aware that it's a high source of calories, and alcohol really adds a lot of calories to your meal. So you have to think that through if you're trying to regulate and keep a check on your weight.